My name is James Mitchell. I'm 51 years old. I have chronic pain in my back. I have bulging discs. I have fibromyalgia. I have diabetic neuropathy and a chronic DVT. 28 years ago or so, and I was working as a carpenter, and I was on some staging and it collapsed, and I fell 25 feet and I broke my neck. I sheared my hip off and shattered my right ankle.
It was a really scary time, not knowing. We didn't know if first I didn't know if he was alive when they first called and said he fell. We weren't sure whether he'd be able to walk again, so that was the biggest concerns, and he went through many procedures.
I had plates and pins and screws in my hip, and eventually my hip deteriorated, and when I had a total left hip replacement, I got a chronic DVT, and I still now and then do get DVTs because my veins are so scarred and my valves are gone.
We thought for sure he probably had a blood clot. You know, I talked to the doctor on the phone. He thought he probably had a blood clot. Went into the doctor, but the emergency people kind of thought that he was only there to get medicine and literally sent us out of there. So we kind of put him in the back of my car. That was the only way he could lay. And drove him straight down to Boston, and sure enough, within a few minutes, a med student diagnosed him with a blood clot.
I've seen numerous doctors over the years. Some have been excellent and some were just terrible. You know right away that you're not going to get any satisfaction from them, and you just can't wait till the appointment's over so you can get out of there. And there's others who truly care about the patients and try to work with you to help you manage your pain.
If they're treated compassionately and they have a set of providers who really focus in on their needs and listen to their voice, they're likely not to be as negatively impacted as someone who's seen as a malingerer or someone who's misusing drugs. So I think that the interactive effect is really critical on the individual.
Seems like some doctors, when you go looking for treatment, when you're in pain, they think you're just there because you want to get narcotics or drugs, and they try to shoo you out the door as fast as possible. It's like being on fire and say, put me out, and people don't see the flames. Like, I had a hematoma in my spine in which I actually got paralyzed from it, and I couldn't move, and I was in excruciating pain. And I went to the emergency room, and they were trying to put me out of the door, and they said, oh, we're going to discharge you. And I couldn't even get out of the stretcher, and I just burst down into tears. And I said, I can't move anymore. It's like I'm going to have my right wrist, I already had it partially fused, and I'm going to have it totally fused, which will make it totally immobile. But it's a sacrifice I'm willing to do, because right now I can't even button my shirt without being in excruciating pain or holding a glass of water.
I don't actually know my dad without pain, and unfortunately as the years have went on, his pain has only increased, and it's been very progressive. When I was younger, my dad had a little bit more functionality and mobility, but now as the pain has progressed and he has more chronic pain conditions, he isn't able to do some of the things that he used to be able to do with me. Throughout my childhood, he always made it to every single basketball game or tennis game, even though the bleachers were so bad on his back and on his spine. He would still make it there for myself, my twin brother, and my little brother. He has made sure that he is still there for us every single day, every single step, supporting us and making sure that we see the beauty in life.
I've had numerous physical therapies on my neck, on my spine. I've seen a chiropractor for probably the past 30 plus years, which out of all of them, I think has given me the most relief. Dr. Narang, he's been working with me over the past several years with various procedures where he does RFLs, where they actually fry the nerves in my spine to block the pain signals making it, as well as doing injections in my spine to cortisone injections to help relieve the pain, as well as prescribing narcotics to help. Sometimes I wish they could prescribe more, because it doesn't always seem to get me to a point where I'm never in pain. Unfortunately, when they prescribe you something new, it seems to work well in the beginning, and then the longer you're on it, it seems to, over time, lose its strength. I think just with my wife, she knows I'm in pain, but it's like, I know she wants to help, but there's nothing she can do.
There's nothing worse than seeing someone you love hurting all the time and not being able to not suffer. So the family feels that suffering. When people feel powerless, they react in a lot of different ways.
Getting help for yourself, which is one thing that I did. I went and I talked with a psychologist because it was hard for me. It was frustrating. Sure, I wish they would come up with something that could, take away his pain. I wish we could find some type of treatment or something that he wouldn't be in this pain like 24/7, like it seems that he is, so that he could enjoy some of the things that he used to enjoy. Those things are hard for him now.
The one thing about chronic pain is it steals your soul. When I was younger, I used to be very happy and go lucky, and when you get through years of chronic pain, it's like holding your hand over a candle all the time, and you just want to scream, and you just can't take the pain anymore. When you deal with pain all the time, it just draws your happiness out of you because you're fighting it all the time. When you're younger, you see a rose and a butterfly, and it kind of brings a smile to your face. And when you get older and you're dealing with chronic pain and you just want to scream because you're in so much pain, you see the same thing. You just kind of look at it and you just glance away because it's not enough to distract you from what you're going through.